So the other thing is that I believe that mobile is social. This is a very social device. And it's only going to increase in its penetration in Canada. Right now, about 84% are expected by 2014 to have mobile access, which is, there's only one way of describing that. That's, basically everybody will have it. And we'll do some comparison data right there. So mobile is very social. When we look at the incidence of traffic to GOC websites from from mobile devices, what we're seeing here on the left-hand graph are the number of visits by year, which are the columns, and then the arrow bars are basically giving the percentage, high, low, and the average of mobile access as a percentage of total visits. And what we're seeing here are the early days of the inflection point of the hockey stick curve. Early days. We're really at the cusp of this right now. And it's going to change. Now the numbers are very low, but they're going to grow. The other thing about mobile being social is this is a trend, a graph that shows the trend in access to sites through either a mobile device or through a desktop device or a laptop device over the course of the day. And the blue is the laptop or desktop devices, and you see it peaks during the workday and then it decreases rather rapidly when people go home. And you look at the mobile devices, it's flat during the workday, but look at this in the afternoon, because that's our social time. I'm on the bus on the way home, I see an out-of-home advertisement about, something, and I key it into my mobile device. So we believe that as these devices continue to increase in their friendliness and the screen size, and the Apple iPhone 4 has got one of the most amazing screens on it, we'll just continue to see that grow. I want to skip this. Search is social. I think I told you that search was social. We're seeing, this is search for cancer, diabetes, which are down here. And we're showing you in green here, cancer there. And the red line here are the number of searches that were done on swine flu during that first outbreak, this just in Canada. And then notice this, all the work to change the language from swine flu to H1N1 was successful because look, H1N1 took off post in the November timeframe. Search is social. Search gives you the language of demand, the language of the population. And we as people in the public health field, we talk to each other, and so we tend to use language which is not the language of demand. But search gives you the language of demand. It's very easy to find. So here's my second ARS question. What was the percentage of traffic to the Public Health Agency of Canada's website from social media sites during the H1N1 event in fall? Everybody thinks it was 5%. Raise your hand. 9%? 12%? And then 25%, or 20%. Okay, the answer is 12%. And that's it right here. We're showing you total traffic, visits to the Public Health Agency site. And this, the green line is the one that I want you to pay attention to. This is the percentage of visits from social media sites during the outbreak, and the date time is down here. And what you see is the extreme rise of that thing. It's key to the right-hand axis over here. And this gets to another thing, is that mobile, not mobile, but social has a velocity impact. Velocity. So, how not to do social media? It's not about the shiny new thing. It's just not. It's just not about the shiny new thing. Complicated slide, I don't have time to explain it because I'm going to run out of time. Which is a great thing to do. It will be available to you. But
I think I'll give you another minute though, because
okay.
I think this is a key slide.
This slide here is essentially saying that, you know what, social media, it's just the enabling technology. It's just the enabling technology. If you do social media without first dealing with your infrastructure issues and your management issues, you'll never be successful at it. You're going to pave a cow path. And as you pave that cow path, you're not going to be able to sustain it. It won't be authentic. It won't be social media in the truest sense of the word. And so you're going to find yourself just running after something you can never supply. Before you even begin to use any of the enabling technologies, you need to have all these support systems in place, which is infrastructure, boring, 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 not sexy at all. Critical. And you need to have these internal processes. You need to have right down here, evidence-based management culture. You need to have content lifecycle and archiving principles. You need to have outcome-based investment strategies. You need to have all those things. Otherwise, you're just kind of feeding the beast, building supply, but you're not really looking and aligning it to demand. This is just the end. And if you can get this right, then you start to get some of the benefits that arise from that. So ideas that spread win, and perceptions that persist matter. I believe that you have the opportunity in the public health space that what you have is the application. The diseases are public health is the platform, and diseases are the application. I have a disease, I would like to share with others about that disease. So, how many of you know about patients like me? To me, this is revolutionary. It's not evolutionary, it's revolutionary. It's essentially open sourcing treatment. So patients that are suffering from diseases, chronic and otherwise, can come to this place, create their own profile and say, this is who I am, this is my profile, these are the drug regime that I'm on, this is the treatment regime that I'm on, and they give up enormous data about themselves. The platform tries to regularize and standardize it so that public health professionals and epidemiologists can understand what this mountain of social crowdsourced information is. So there's all kinds, this is just for mood conditions, so depression, bipolar, what have you. There's 16,000 different people that have shared information about themselves. Demographic data is hugely detailed. Real-world data about what people are taking and the number of patients taking them, the trend in their moods and everything. You can go down and drill into it. This is all publicly available right now. Don't need to have anything associated with this. Anyway, mood conditions, the treatment regimes they are on, and the percentage of them. People give information of themselves that you could never ask them to do with all kinds of double blind and all kinds of cloud. It's all there. It's all there. The disease of the application is the application. The platform, public health is the platform. So you can't pave cow paths. In the information marketplace where search is the upstream end, you really need to say that that is the first place that people engage with me. Your platform should be open. You release your content into the cloud. Kind of cloud computing, content in the cloud, wherever it lands, that's okay as long as it gets read. You can crowdsource experience and capture that knowledge by doing so. I'd like to just say that, imagine this. This device, by the way, by 2014, more of these will be sold than laptops. Right? This device, the amazing thing about it is that it's location aware. So if I'm tweeting or if I'm updating my Facebook profile, if I'm searching on cancer, you can actually find all the mobile searches on cancer and understand if there are any cancer clusters by the number of people that are searching using this device. This becomes the #1 platform. So it's just a totally different way of thinking about it. And finally, I'm not a huge fan of Reagan, but he did say one thing that was really good. He said, trust but verify. And that is, if you're going to embark in the social media space, it's really tough to sustain that effort, and it's really tough to justify investment. We know we're coming into an era where there's going to be a crunch on budgets. So the only way to demonstrate success is to measure, and that's my focus in life, is about measuring. But it's not about the number of followers, it's not about the number of fans, it's not about the number of tweets, it's all about engagement and about whether or not people are able to take informed decisions as a result of that engagement. So with that, I turn it over to Steve and say thank you.
Thank you.